With the patient seated edge of the table, begin the assessment by assessing the biceps and triceps deep tendon reflexes. Beginning with the hand on the contralateral knee, have the patient draw the hand up to the ipsilateral ear. Instruct the patient to touch the lumbar spine.
With the forearm in neutral and the elbows at 0 degrees extension, have the patient flex the shoulder to 90 degrees. With the shoulder at neutral and the elbow flexed at 90 degrees, have the patient pronate and supinate the forearm. With the forearm pronated and the elbow at 0 degrees, have the patient abduct the shoulder to 90 degrees. With the forearm at neutral and the elbow extended at 0 degrees, have the patient flex the shoulder above 90 degrees. Next, with the forearm in neutral and the shoulder at about 30 degrees, have the patient pronate and supinate the forearm.
And the elbow flexed to 90 degrees, have the patient extend the wrist to 15 degrees. Apply resistance to the extended wrist. Have the patient repeatedly extend and flex the wrist. The shoulder in slight flexion and the elbow extended to 0 degrees. Have the patient extend the wrist to 15 degrees. Apply resistance to the extended wrist. With the shoulder in the neutral position and the elbow flexed to 90 degrees, have the patient circumduct the wrist. With the shoulder in the neutral position and the elbow flexed to 90 degrees, have the patient flex and then extend all the digits. Have the patient demonstrate a hook grasp. If able, provide resistance. Have the patient grasp a scrap of paper or a crisp $20 bill between the thumb and the second MCP joint. Apply resistance. Have the patient grasp a pen with a pincer grip. Provide resistance. Hand the patient a cylindrical object. Provide resistance. Hand the patient a spherical object, such as a tennis ball or a lacrosse ball. Provide resistance.
Have the patient with the index finger touch the knee and then the nose 5 times. Compare to the other side for grading.
With the patient seated on the edge of the table, assess the patellar and Achilles deep tendon reflexes. Have the patient flex, abduct, and externally rotate the hip, flex the knee, and dorsiflex the ankle. Beginning in the flexor synergy position, have the patient extend and adduct the hip, extend the knee, and plantar flex the ankle.
With the patient in a seated position and sitting on the edge of the plinth, have the patient maximally flex the knee. Next, with the patient sitting on the edge of the plinth, have the patient maximally dorsiflex the ankle. With the patient in the standing position and the hip at neutral, have the patient flex the knee to 90 degrees. Next, with the patient still standing, have the patient actively dorsiflex the ankle. Wow.
With the eyes closed, touch the heel to the opposite knee 5 times as fast as possible, compared to the other side for grading purposes.